If you're dealing with fertility challenges, the issue isn't about how much effort you're putting in, it's about knowing what actually helps and what doesn't. So, why does so much advice out there actually miss the point? Fertility advice is everywhere, and most of it is well intentioned. I think the mistake that most people make is they forget that infertility is a complex medical condition that requires treatment. It's not purely a lifestyle problem that you solve with some sort of DIY, do it yourself approach. When fertility is treated like something that you can solve yourself, what actually happens is you waste valuable time and money without actually ever achieving your goal of conception. And in the end, of course, you're just left feeling more upset, overwhelmed, and hopeless. So, what actually helps fertility? There are the classic conventional approaches to fertility, like hormonal therapy, and different types of assisted fertility techniques, like IVF and IUI. And then, of course, there's the natural fertility approaches, which can actually be more effective when they're targeted, timed, and guided. From a Chinese medicine perspective, fertility depends on things like cycle regulation, blood flow, circulation, and tissue responsiveness. Meaning, we need to manage factors like inflammation, blood flow, hormones, nervous system regulation, and recovery to influence fertility. And Chinese herbal medicine is specifically used to help in these domains. In fact, the most up to date research that we have shows that Chinese herbal medicine is 2 times more effective than hormonal therapy alone. So, what matters most is starting off with a proper fertility assessment that gives you clarity as to what your patterns of dysfunction are, rather than just applying generic solutions. If you're listening to this and you're trying to figure out what you should do next, I have a 1-minute fertility quiz that helps to orient that decision. You can find a link in the description below. So now we know a little bit about what does work. What's a waste of time when it comes to fertility treatments? So many people turn to the DIY strategy. They're putting together supplement stacks, things like CoQ10, vitamin D, prenatals, and following influencer routines, trying to cover all their bases. And that impulse to do so is understandable, especially when you're feeling pressure to conceive. The problem is fertility behaves like a system, and systems don't respond well to a bunch of scattered inputs. Taking individual supplements, randomly changing diets, or doing affirmations can create a feeling of control and progress, all the while you may not be creating any meaningful change at all. So here's how I recommend approaching support moving forward. Remember, the most effective fertility support isn't about just doing more. It's about doing what matters. That means you must work with a specialist that treats infertility regularly. That can be using Chinese herbal medicine as a standalone option, or using it in conjunction with other conventional approaches like IVF, for instance. What I simply do not recommend is trying to solve this thing alone. If you're looking to talk this through properly, with your history, your timing, and your priorities in mind, the next step is a fertility consultation. This is where we can decide what's the best kind of support for you, and where we can ultimately help you realize your dream of becoming a parent. So now that you know some of the do's and don'ts in fertility care, you're going to want to know what actually matters when trying to get pregnant after 40. Click the video on the screen and I'll show you now.